Well, welcome everybody. Thank you for joining us today on our virtual lecture on Zoom. Just a few housekeeping points to start with. I wanted everyone to know that we will be having a major virtual event on May 26th called Girls Night In. Usually we have a Girls Night Out event every once or twice a year, but because everyone's indoors, this is going to be a Girls Night In event to help with COVID philanthropies. A portion of the proceeds will be going to frontline workers. And this will be a really fun event, up to 50% off on all services, procedures, and products. May 26th from 5 to 9. You can go to our website under the events page and click on how you download. We're doing this using a Socio app. You just have to download the Socio app and it will tell you how to get on the event. We have a raffle, 15 different free prizes, including one area of Smart Lipo, 4 areas of M-Sculpt, other free treatments in a raffle. We'll have special giveaways, Eli Tahari, a special $1,000 gift certificate. We'll be having Dr. Max Gomez, the CBS health anchor, answering all kinds of questions about the COVID virus. And then we'll be having free mini consultations with our staff, with Dr. Fisher, myself, and our PAs and nurse practitioners on any cosmetic treatments you're interested in. So it'll really be great, and up to 50% off on major procedures. That's a really great event to help sponsor COVID philanthropies. So let's get on with the lecture. I'm going to be talking today about how to rid yourself of dark circles under the eyes and how to get rid of aging eyelid skin. We'll have questions and answers at the end of the talk in the meantime. So these are my disclosures. So basically, tear troughs are a really common problem we see in a lot of our patients in our practices. You see these different areas here of loss of volume. These are called tear troughs, and they're really not due to puffiness above it, the area here, but due to loss of volume here, as you can see here as well on the lower eyelids. Here's another example, and they often appear as dark circles. People think they're dark circles due to pigment, but it's really due to loss of volume and the shadowing that occurs. But in other instances, as I'll show you later in the lecture, it can be due to some other issues also. So it's really important to do a good physical exam to determine what the actual cause of these deep tear troughs are. And then other examples here of dark circles, but when you look closely, you realize that it's sort of a trough, a depression in the area below the eyelid. We would call it tear trough that causes the dark circle appearance. But we can see it in kids also. Children have these tear troughs as well, obviously in children not due to loss of volume, but just a normal developmental change. And we see it in non-humans as well, as you can see here with little deep tear troughs here. There's a little monkey photo. But some deep tear troughs really are due to big bulging fat pads here, as you can see in these people, and that really requires surgery, not fillers. So it's important to distinguish what works for fillers and what really needs surgery. As you can see here, this person obviously has big puffy lower eye fat pads that really need surgery. We can often make them to go away without any procedure at all, just using makeup. As you can see here, we can make them go away just using makeup, but a lot of people want them to go away and not have to use makeup as a cover-up. And as I'll show you, we'll do a live procedure to show you how easily it's done without any downtime and really virtually painless. So this is what the normal eyelid looks like. You don't have those tear troughs. You just have a normal lower eyelid with nice volume at the lower eyelid here. But what people ask, well, why do people develop tear troughs over time? And basically it's due to loss of volume in the fat compartments. This is the normal fat compartment here in normal person before they develop tear troughs. And as these fat pockets atrophy and they sort of go down with gravity, they sink lower and lower. As you can see here, they shrink, and then you get these tear troughs because of the loss of the fat pad due to loss of volume from the aging process. So really the first approach to treating tear troughs is using fillers. But most importantly, you want to make sure the doctor who is doing the procedure has a lot of experience. This is an area, as you can see here. This is just the blood supply with the arteries in the area. So you have to know your anatomy, make sure the doctors have a lot of experience before they do this, because you're going to end up hitting these blood vessels and causing major bruising and swelling, and making sure people using the right cleansers around the eye. You know, a lot of doctors use Hibiclens as a cleanser on the face, but what has recently been found is that this particular Hibiclens can cause eye inflammation. So we use hypochlorous acid. That's important to clean the area around the eye. It's important to use hyaluronic acids as the filler. When other fillers such as radius or calcium hydroxyapatite have been used, they can get these yellowish discolorations in the area or swelling. And the best way to really treat the tear trough area is not to use needles. We use cannulas. These are blunt tubes which we use to inject the filler. This is really the safest way to avoid hitting blood vessels and to reduce the risk of bruising and swelling as a result. What we do when we actually do the injection is that we inject under the muscle in the eyelid, as you can see here, so that we are not allowing what's called a Tyndall effect from the hyaluronic acid. That's a bluish discoloration if the filler is injected too superficially. So again, make sure you see someone who's experienced, like we have our doctors here at Juva who know the anatomy, so you don't have side effects from the procedure. So the ideal result, as you can see here, tear trough before treatment and then clearing after. And I'll just tell you some real live results from the actual fillers. You know, we're going to talk about aging skin around the eyelids in addition to the tear trough, and this is one of the newest technologies for doing that. That's the TempSure device. We were one of the first to have it in the country, and this is a very powerful radio frequency device, 300 watts. It's an expandable platform. It's a non-invasive treatment, so there's really no downtime. We have 4 different platforms on this device, and we can set it so that it's very accurate. We set a certain target temperature for the technology, and it stays constant. And these are the different hand pieces, as you can see here. For working around the eyes, we have a very small hand piece. On the face and the body, we have larger ones as well. And it really gives us the versatility to work in different areas of the body. And this is someone who has loose skin on the upper cheek area here. And just by using TempSure, usually we do 3 or 4 treatments, no downtime. It's a 15-minute treatment, and you get nice clearing. Another example here of the wrinkles on the upper cheek area near the lower eyelid, and treatment after as well. What we do for lower eyelid wrinkles, not the area like I just showed you here on the sides and the upper cheek, but the wrinkles really on the eyelid itself. We can do it for the upper and lower eyelid. We do what's called the Madonna lift, and this treats eyelid wrinkles and loose skin. And what it does is create these columns of microscopic thermal wounds at specified depths without damaging other tissues. This is called microablative CO2 or carbon dioxide. And if you take a look here, when we see these actual laser columns, you see each of these columns creates like a zone here that takes away damaged tissue and causes shrinking, as you can see here. But because they're spaced apart and there's normal skin between them, as you see here, the healing is really very quick. So there's really very little downtime. As a result, people get a little bit of redness and swelling. And here are the results that we see using the Madonna lift. You can see the eyelid skin on the lower eyelid and on the upper eyelid, the tightening, the nice tightening effect, and removal of the wrinkles. Another good example, eyelid skin below, before and after. Look at the dramatic improvement. I mean, that is a great result. Again, no downtime. Usually 3 to 4 treatments, depending on how how much wrinkling and loose skin there is. And this shows you what kind of downtime there is. This is the person had the treatment. This is baseline before treatment. And this is 24 hours after the Madonna lift. And just using a little makeup, you can see there's really no redness or swelling that's evident at all. So this is actually how we do it. This is a video showing the Madonna lift in action. This is the laser beam. We actually put down these sort of little squares or rectangles of columns. You can see each of those little dots if you look closely, but each dot has normal skin, between them. So the healing is very quick. If we just took away the entire skin without these dots with spaces between them, the healing would be take a lot longer. So this is called fractional CO2. You may have heard of Fraxel. This is obviously newer technology than Fraxel. And these little zones of ablation create normal columns in the skin to take away the damaged collagen so that new, fresh collagen comes in. And as you'll see in a moment, we protect the eyes using metal shields, so there's no risk to the eyelids. You can see in just a moment, the metal shields are put in the eyes, and it's very safe for the eyes because and people say, well, I hate having shields put in my eyes, it must be really uncomfortable. Well, no, we put drops of anesthesia on the eyes, so you don't even feel them going in. We put special antibiotic ointment on the undersurface of the shield, so there's no irritation to the eye, and people walk out normally after without any problems at all. And you can see that's Madonna lift. And sometimes we have other issues that cause dark circles on the eyes, as you can see here, little blood vessels, little veins here. And when people have a lot of them, they can actually cause dark circles too. And these are easily treated, as you can see here, we're using a pulse dye laser. This is before, and on the left and the lower left, after treatment. Again, we use metal shields to protect the eyes. We can take away these blue veins on the eyes as well using a laser, pulse dye laser, before and after. So for people who have textural problems on the eyelids, a new approach is called platelet-rich plasma, or PRP. And this is a very natural treatment. We take blood from the patient, so it's the patient's own blood product, so there's no risk of allergies to it. And it has a nice filling effect, but more importantly, it really improves the texture and the surface changes of the skin. So we did a study a while ago to evaluate the safety and efficacy of PRP injections to the eyelid area. And we did digital photos as well as 3D imaging to evaluate the changes. And this was a 10-patient pilot study. And all we did is basically apply a local anesthesia, topical anesthesia, no injection, just an ointment that we put on to numb the area. And then we injected the platelet-rich plasma using micro cannulas. There were 8 females and 2 males in the study itself. And basically, we did the imaging to evaluate the changes. And here you can see at baseline before the treatment, the deep tear troughs and rough skin, and look at the nice filling effect of the PRP and improvement of the texture of the eyelid skin. Rather dramatic improvement. Here's an example of the textural changes in a surface area improvement as well. And when we did 3-dimensional imaging, the green area actually indicates the depth, the deepest part. And at 6 months, you can see there's very little green left. So it indicates that the area has been lifted and the texture itself is a lot smoother as well. So here's an example of using Restylane to fill the tear trough. I'll let you take a look at this video, the actual Restylane treatment of a tear trough. We use a blunt cannula. We put topical anesthesia in, just numbing cream to numb the area. And then we inject one of the muscles. This is a cannula, not a needle. So there's no risk. You can see you get deep tear troughs. We're slowly filling in that deep tear trough. the improvement already. This is on one side, on the right eye. The teardrop is basically gone. So we have the patient sit forward because when you lie back, it looks like you need less product. When you sit forward, we can actually see that we put in exactly the right amount. Look at the difference already. Right eye compared to the left eye, which is untreated. So I like to show patients the results on one side and see their reaction. Look at the reaction.
Oh, wow. Yeah.
Pretty good, eh?
Yeah.
I look good?
Yeah.
See? I'm going to talk circles. Right?
That's for sure.
What?
Yeah, it's pretty remarkable.
And then we'll use a little needle at the sides of the teardrop to fill in those areas. Those are hard to do gently with a cannula, as you can see here, but it's really perfectly tolerated. She's not really having much discomfort at all. Look how nice that teardrop is filled in. The left side is now filled in as well. We're just fine-tuning with a little needle. Massaging it in to make sure it's nice and smooth. So that's the video showing the Restylane injections, and look at the before and after. This is immediately after on the right side. The teardrop has been filled. The texture is a lot smoother. All you see are the little needle sticks here, and that goes away really quickly. Here's another side view of the teardrop before and after. So thank you very much for your attention. And now we'll take some questions. Let me just see if we can open this up. Let's see here.
Yo nada más no voy a hacer más de 1:30 porque think
I'm sorry, I can't hear you. Anyone have any questions?